Alzheimer's disease and dementia. Psychology. Alzheimer's disease and dementia. Alzheimer's disease and dementia is a loss of mental functions that is severe enough to interfere with a person's daily functioning. The loss of mental functions: thinking, memory, reasoning. Change may also occur in personality, mood, behavior. Alzheimer's disease continued. Dementia is not a disease itself but rather a group of symptoms that go along with several different diseases or conditions. Is irreversible when caused by disease or injury, but might be reversible when caused by drugs, alcohol, hormone, vitamin imbalances, or depression. Alzheimer's disease continued. Dementia develops when the parts of the brain that are involved with learning, memory, decision-making, and language are affected by various infections of diseases. The decline of intellectual functioning is not as widespread as most people believe, and it is not a normal part of aging but is in fact caused by disease. Alzheimer's disease continued. Dementia count. Old age dementia is not inevitable. In most cases, declines in intellectual functioning do not significantly impair people's lives as they age. Most people retain the bulk of their mental abilities throughout their lives. Alzheimer's disease continued. Dementia count. Some people do develop dementia in late adulthood. The most common cause of dementia is Alzheimer's disease. Alzheimer's disease is a degenerative brain disease and is not a normal part of aging. Alzheimer's disease continued. Other causes of dementia. There can be many causes of dementia other than Alzheimer's disease. Example: vascular dementia is caused by blood flow-related problems. There are at least 51 different causes of dementia. Alzheimer's disease continued. Other causes of dementia continued. Alzheimer's, Parkinson's and Huntington's are degenerative neurological diseases in which neurons in the brain are being attacked by the disease. Huntington's is caused by a single abnormal gene. It is a genetically inherited disease. Middle-aged people can have Huntington's and Parkinson's. Alzheimer's is found among the elderly. In all of these diseases, the brain is slowly disintegrating. Alzheimer's disease continued. What is a stroke? Example: multiple infarct dementia is also caused by blood flow-related problems. Multiple infarct dementia is caused by multiple strokes in the brain. A stroke is a serious medical condition that occurs if the brain does not receive an adequate supply of blood. Alzheimer's disease continued. What is a stroke? Count. The constant circulation of blood through the brain provides it with oxygen and nutrients. Permanent damage can occur if the brain lacks enough oxygen for 3 to 10 minutes. Strokes can be caused by blood clots, cerebral hemorrhages, bleeding in the brain, and other causes. Strokes can cause dementia. Alzheimer's disease continued. Stroke symptoms: dizziness, tingling sensations in the skin, fingers, toes, arms, legs, weakness or exhaustion, slurred speech, visual problems in one eye. Alzheimer's disease continued. This is a brain image from a 45-year-old woman who noticed the sudden onset of right body weakness and trouble speaking. Stroke occurred on left side of the brain which caused right body weakness. The Broca's area was affected by the stroke since she was having trouble speaking. Alzheimer's disease continued. This is a brain image from a fatal stroke. This patient died. Alzheimer's disease continued. Other causes of dementia continued. Chronic drug use. Prolonged depression. Fluid accumulation in the brain due to brain development problems. Brain infections. Brain injury. Brain tumors. The discovery of Alzheimer's disease. Dr. Alois Alzheimer, German neurologist. Findings. Conducted a post-mortem examination of the brain of a 56-year-old woman who died after years of progressive mental deterioration and dementia. The examination disclosed that cells in her cerebral cortex were bunched up like a rope tied in knots. Cellular debris, waste, had collected around the affected nerves. The discovery of Alzheimer's disease continued. Dr. Alois Alzheimer findings continued. These destroyed areas of the brain came to be known plaques and tangles. Tangles are twisted fibers within neurons. Plaques are deposits of proteins and parts of dead cells found between neurons. Alzheimer's disease. Alzheimer's disease causes 50 to 70% of all dementia. Approximately 5.2 million Americans have Alzheimer's disease. Dementia has become even more common among the elderly in recent years. Alzheimer's disease. Alzheimer's disease. Medical authorities estimate that by the year 2050 that 14 million Americans will be affected by Alzheimer's disease. It is not clear if the apparent increased frequency of dementia reflects a greater awareness of the symptoms or if people are living longer and thereby more likely to develop dementia in their older age. Alzheimer's disease. Cognitive abilities. As we age, all of us will experience changes in our cognitive abilities. Our fluid intelligence begins to decline. Adult cognitive development. Fluid intelligence. One's ability to reason speedily and abstractly tends to decrease during late adulthood. Adult cognitive development. Fluid intelligence declines. Older people typically require more time to solve problems. They have greater difficulty with tasks that involve pattern recognition, such as piecing together jigsaw puzzles. Older people have more difficulty remembering new information, such as people's names. Adult cognitive development. Crystallized intelligence. One's accumulated knowledge and verbal skills tends to increase with age. For instance, one's vocabulary grows over the years as well as general knowledge and information. Adult cognitive development. Crystallized intelligence count. One's accumulated knowledge and verbal skills tends to increase with age. For instance, one's vocabulary grows over the years as well as general knowledge and information. Recognizing the symptoms of Alzheimer's disease. People with mild Alzheimer's disease may have difficulty learning and remembering new information, have difficulty managing their finances, planning meals, or taking medication on schedule, show symptoms of depression, sadness, decreased interest in usual activities, loss of energy. Recognizing the symptoms of Alzheimer's disease. People with moderate Alzheimer's disease may forget old facts, such as past careers or the names of friends. Seem agitated, restless, or anxious. Lack concern for their appearance, hygiene, or sleep. Recognizing the symptoms of Alzheimer's disease. People with severe Alzheimer's disease may refuse to eat, fail to recognize family or other familiar faces, have difficulty with essential activities of daily living, including toileting and walking. Alzheimer's, neurotransmitters. Alzheimer's disease, brain structures affected. Hippocampus. Brain structure located in the limbic system responsible for new learning and memories. Damage to the hippocampus results in an inability to form new memories. Cholinergic neurons are being destroyed by the Alzheimer's disease. These neurons produce acetylcholine, which is a neurotransmitter involved in new learning and memories. Alzheimer's disease, brain structures affected. Hippocampus continued. The hippocampus of Alzheimer's patients has been found to be smaller than in normal people. Even a healthy person experiences a reduction in the size of their hippocampus as they age. Alzheimer's disease, brain structures affected. Hippocampus continued. Older healthy people, who did not have Alzheimer's disease, experienced a decrease in volume of their hippocampus by about 4% over a 2-year period. During that same 2-year period, Alzheimer's patients had a decrease in volume of their hippocampus by 10%. A smaller than average hippocampus in the elderly predicts the onset of the disease. Alzheimer's disease, brain structures affected. Cerebral cortex. Outer layer of the brain, the body's ultimate control and information center. Alzheimer's disease, brain structures affected. Cerebral cortex. Interference with the cerebral cortex causes emotional outbursts, disorientation, aimless wandering, becoming lost, decline in judgment, reasoning, and decision-making. Ability to recognize faces is lost. Alzheimer's disease, brain structures affected. Cerebral cortex. Alzheimer's interferes with everyday tasks performed in this area of the brain, such as balancing your checkbook, making a telephone call. Alzheimer's disease, brain structures affected. Ventricles. The chambers within the brain that contain cerebrospinal fluid. Sulcus. The grooves, or furrows, of the brain. Alzheimer's disease and the brain. There is an overall shrinkage of brain tissue in the Alzheimer's brain. Alzheimer's brain. Normal brain. Alzheimer's disease and the ventricles. The ventricles, or chambers, within the brain that contain cerebrospinal fluid are noticeably enlarged. Alzheimer's brain. Normal brain. Alzheimer's disease and the sulcus. The grooves, or furrows, of the brain called the sulcus are noticeably widened and there is shrinkage of the brain tissue. Alzheimer's brain. Normal brain. Alzheimer's SPECT scan. http://www.themainclinics.com/thescience/spect gallery/item/dementia versus pseudodementia. Category _I.D. = 129. Alzheimer's SPECT scan. Alzheimer's SPECT scan. Alzheimer's SPECT scan. Alzheimer's disease, medications. Aricept, Tacron, Exelon, Ruminal, Namenda. Alzheimer's disease, medications. Aricept, acetylcholinesterase inhibitor. A drug that can provide some relief from the symptoms of early Alzheimer's disease. Temporarily improves brain function in some Alzheimer's sufferers. Does not halt the progression of the underlying neural destruction. Works by increasing the neurotransmitter acetylcholine, which is used in learning and forming new memories. Alzheimer's disease, medications. Namenda. A drug that can provide some relief from the symptoms of early Alzheimer's disease. Slows the progression of symptoms. Does not halt the progression of the underlying neural destruction. Works by increasing the neurotransmitter glutamate, which is also involved in memory. Alzheimer's disease, brain reorganization. Synaptic plasticity. The brain has a remarkable property called synaptic plasticity. Synaptic plasticity is the ability to strengthen neural connections at synapses as well as to establish new synapses. However, the brain's plasticity is severely limited when it comes to repairing damage. Most brain damage leaves the victim permanently disabled in some way. Alzheimer's disease, replacing brain tissue. One approach to helping people recover from brain damage is to replace lost brain tissue with tissue from another brain. Scientists have transplanted, or grafted, tissue from a still developing fetal brain into the brain of an adult animal of the same species. If the receiving animal does not reject the tissue, the transplanted brain tissue sends axons out into the brain and makes some functional connections. Alzheimer's disease, replacing brain tissue. Replacing brain tissue continued. This treatment has reversed some animals' learning difficulties, movement disorders, and other results of brain damage. The technique has also been used to treat a small number of people with Parkinson's disease, a disorder characterized by tremors, rigidity of the arms and legs, difficulty in initiating movement, and poor balance. Alzheimer's disease, replacing brain tissue. Replacing brain tissue continued. The brain tissue transplant procedure is promising, but because its use with humans would require tissue from aborted fetuses, it has generated considerable controversy. Alzheimer's disease, nerve growth factor. Another treatment uses engineered cells from rats to produce nerve growth factor, a substance that helps stimulate and guide the growth of newly sprouted axons in the central nervous system. When the engineered cells were implanted into the brains of rats with brain damage or disease, the cells secreted nerve growth factor. Alzheimer's disease, nerve growth factor. Nerve growth factor continued. Based on these animal studies, nerve growth factor has been infused directly into the brain of a person with Alzheimer's disease. The results were encouraging, and trials with other patients are in progress. Alzheimer's disease, stem cells. Scientists have been studying the formation of new neurons in the brain. Alzheimer's disease, stem cells. The source of these new neurons has recently been identified as stem cells, which reside in the lining of the ventricles of the brain. The discovery of these stem cells, which have the ability to develop into many types of cells, including neurons, creates the exciting possibility that degenerative disorders such as Alzheimer's disease may eventually be cured by actually replacing dying neurons with new neurons. Alzheimer's disease, other possible preventative measures. Blueberries, antioxidants may be linked to improved memory. Aspirin/ibuprofen might decrease the rate of cognitive decline. Vitamin E. Vitamin B12. Estrogen replacement in women. Testosterone replacement in men. Long-term care. Provision of a safe environment, control of aggressive or agitated behavior, and the ability to meet physiologic needs may require monitoring and assistance in the home or in an institutionalized setting. This may include in-home care, boarding homes, adult daycare, or convalescent homes.